Thank you very much for inviting me to share some of my thoughts about exercise in myositis. And I guess I started with this title because I really wanted to sort of help people feel confident with exercise, especially in young people with myositis. And within our unit, we actually see exercise as being a very, very important part of their care, as important as the medication. And what we aim for is that as medication is tapered down, the exercise is able to be increased back into, normal life and, to high levels for young people. Sorry, there we go. So I guess what I really want to cover over the next few minutes is really thinking about the fact that exercise is going to be safe in young people with myositis. And it's safe at all stages of disease activity, which I think is really, really important. There used to be a great myth that you couldn't exercise in acute juvenile dermatomyositis, but actually the evidence behind that, well, there wasn't really any evidence behind that, and the evidence coming forward shows that exercise is safe even in really active disease. You just need to make sure that the exercise is appropriate for the level of ability of each individual. It's also really important to realise that exercise is vital to maximise independence, strength and mobility. And also there's a great thought now that exercise may slow the disease progress and reduce inflammation. And I'll talk about that a little bit more as well. And exercise is going to be vital for any degree of recovery and repair in young people with myositis. So what I really want to do is impart confidence for you with supporting young people with exercise, even when they have myositis. And I'm also going to just give you a little bit of science behind it as well. But I think what's really important in looking after anybody, whatever age, is we think about everything in a biopsychosocial model of care and how exercise fits into that. So biopsychosocial, so bio is about the biology of the body. Psychology is about how you're thinking and feeling and about what you believe. And then the social is how that fits into your life. So into school, into your family. And I think if you follow that model of care, you can see benefits of exercise in all aspects of an individual's life. And I think that's really important. So if we go back to what causes muscle weakness, in myositis. So some of the cause we don't know, it's an unknown event. Some of it is obviously inflammation, and the more acute the onset, the more severe the inflammation. And high levels of inflammation in myositis associate with high levels of muscle weakness. But also long-term corticosteroid treatment is also known to produce muscle weakness. So then we end up with a bit of a sort of a balance that we have to put together, is how active is the disease, but how high are the steroids that we're using to control it, and how does that combination impact on muscle function. But then there's also something that I think gets really forgotten, and that's deconditioning. And deconditioning is about losing the function just by not.
Oh, sorry, Sue, are you there? You seem to have frozen.
Been allowed out for very much time. They've not been playing sport, they've not been doing physical activity, and we're seeing an enormous amount of deconditioning. And so young people with myositis who are poorly and who are sick, they're also losing muscle weakness because of inflammation, but it's also making them unwell and tired and reduced motivation, and that means that they do less. So muscles that are not potentially affected by the inflammation will also start to get weak and lose their function just by not being used. And muscles start to lose their strength within 24 to 48 hours. And what we notice is the maximum muscle loss is in the first 6 weeks. Now, obviously, if you have an active disease process going on as well, then that loss will continue and continue, but it's just the trajectory down is very quick at the beginning. And I think what's really important to understand is that muscles only recover with use. So we have lots of medication available to stop the disease process, but actually what's going to ensure that there's a recovery of function and strength will be with exercise. So why do these children have weaker muscles than you'd expect? Well, some of it is related to inflammation, and some of it's related to pain, and some of that pain is inflammation and biomechanical. So when you start to have an inflammation in a muscle, that will change its function. But as we know, myositis is not consistent, it's patchy. And so some muscles are affected more than others, and proximal muscles are affected more than distal muscles. And once you have that change, that also causes a biomechanical change of the body. So you end up with some muscles being stronger than others, and it changes the way that you use your body. It changes movement patterns. And movement patterns, if they become abnormal, will cause pain, and pain will promote muscle weakness as well. So you can start to see that there's a vicious pattern of an inflammation that's an unknown cause because of myositis, but then this starts to cause other responses and other effects to our muscle function. So once you're sore and you're painful and you're not able to move, that affects your muscle function as well. That then reduces your ability to move and reduces your ability to participate in activities. But as you all know, young people with active myositis are also generally unwell, and they have sort of a systemic effect of their illness as well. And that then will also affect how they're able to move and how they're able to function, and reduce functioning and reduce movement will have an impact on muscles. And then the disease itself, which I've alluded to, will also directly affect muscle function. So I'm going to talk about cytokines, which is what my little diagram is, and just very little touch on metabolism of muscles. So I've talked about biomechanical changes, and I've talked about the fact that inflammation is patchy within the muscles, and the diagram just shows that some muscles cannot be affected and other muscles are really severely affected. And when that happens is that young people want to keep moving. And so when they try and keep moving, they use the muscles that they have. So those muscles start to get stronger, and the muscles that have been more affected get used less, and so they get weaker. And you end up with this abnormal movement. And abnormal muscle patterning. So muscles don't start firing in the right order. And that then changes the way that the forces get transferred through the joints, and you end up with some joint instability. And all of that movement becomes much, much harder for young people and will really contribute to fatigue that they experience. But also what I find is that young people with active myositis, they want to keep walking and keep mobile, but they do that by resting on their ligaments rather than using their muscle control. And in our unit, we would stop functioning. We would stop the young person doing very much walking because they actually cause themselves more longer term problems with overstretching their ligaments and causing this joint instability. So while they're in an acute phase, we limit weight bearing activities until we regain proper muscle patterning so that they're safe to move. So if I move on just to talk about cytokines, cytokines are little molecules that take messages from one cell to another. And I'm just going to talk about two main cytokines. One of them is TNF alpha and the other one is IL-6. And we now have medication that works on blocking the TNF alpha and also blocking IL-6. But these cytokines are really important for normal muscle control and function as well. They're not just involved in inflammatory processes. So TNF alpha is really important for normal control of muscle cell development. And it's also really important for apoptosis. And apoptosis is programmed cell death. So what you have in any body, but in the muscle cells, is that you grow new muscle cells, but somehow the old ones have to get killed off to make room for the new ones. So you end up with this sort of cycle of life, growing new cells, then they're sort of adult cells, and then as they become grandparent cells, they need to be removed using apoptosis. So TNF alpha is really important for that cycle. And if you have too much TNF alpha, which is really something that we found in myositis, is that that will affect the contractile functioning. So what it means is that the strength of the muscles contraction becomes less. And also the growth of the muscles slows down and you get an atrophy and less repair. So it affects this whole cycle by having too much TNF alpha, which is what's brought about by inflammation, will affect the normal growth and development of muscles. IL-6, however, is much more about metabolism control. So IL-6 is around controlling the energy supply for muscles to be able to function. But IL-6 is also a pro-inflammatory cytokine, and you need this cytokine for a normal response to help your muscles grow and develop. And it's very exercise dependent. And so the more you exercise, the more you produce IL-6 because you need more food for the muscle. And the more IL-6 you produce, the more inflammation you stimulate within the muscle. And the more of this type of inflammation that you stimulate in normal muscle control, that's what fires up the muscles to grow and to develop further. So it's a very normal part of muscle process. And TNF alpha and IL-6 work together. So if TNF alpha levels go too high, they will drop down the IL-6 levels. Because the IL-6 levels drop, the TNF alpha drops, then the IL-6 goes up. So they keep each other in sort of a homeostasis. But what you also need is to be able to control that in a way that's healthy for the body. So we know we've got myositis happening, which is a disease process, and we need medication to control that. But also what we know is that regular and moderately progressive resisted exercises, and I'll talk about what that looks like, is also evidence-based to reduce and stabilize this production of IL-6 and TNF alpha. And so what that does is that stabilizes this growth and repair of your muscles and stabilizes the energy requirement of your muscles and also stabilizes that inflammation. And so what it's been shown is that this type of exercise program is an anti-inflammatory exercise program and very healthy for your muscles, even if you have a muscle disease. And then just to add to that as well, is that what we know about muscle repair is that there are certain cells, they're called satellite cells, and they are produced when you're growing and developing within the uterus. And so basically, as you grow and develop, you lay down satellite cells that are there. They're precursors to muscle cells, and they're just waiting to be asked to come and either grow some muscles or repair some muscles. And they can actually increase the number of muscle cells as well. And they can form new fibers and repair damaged segments. So what you're needing in myositis is when the inflammation has damaged those muscle fibers from this disease process, you're needing exercises to be able to stimulate the satellite cells to come into the muscles to be able to replace them, repair them, and enable them to grow and redevelop. But satellite cells are only stimulated by exercise. So again, it's another very strong piece of evidence as to why exercise is going to be as important as medication. So one of the things, another thing that young people experience with myositis is this extreme fatigue that they're, that they suffer from. So it's not only about weakness, but it's also about fatigue. And the fatigue, as I alluded to, is partly related to the inflammation, and it's partly related to active disease, and it is also related to muscle weakness, both sort of specific muscle weakness, but also deconditioning and reduced aerobic fitness of the whole body as well. So you've got inflammation, active disease, muscle imbalances, muscle weakness, deconditioning of the whole body, as well as reduced aerobic fitness. So very many systemic reasons for having fatigue. But I think the other thing we must remember is that there are also sort of not only the biological causes of fatigue, but there's also the psychosocial. So emotional factors and psychological factors, which will impact fatigue. And I think it's just really important to remember that, perception of illness and perception of fatigue levels and normal fatigue levels, I think is important to always hold in the back of our mind, because what we don't want to do is take on the symptom of fatigue and necessarily always treat it with medication, when perhaps maybe that fatigue is due to muscle weakness, or that fatigue is due to psychological factors and a perception of concern about disease process going on. So I think we need to always hold in our thoughts the biopsychosocial model, so we treat with the right things. So if there's something particularly stressful going on at school for young people, then that potentially will cause them more fatigue. And what you don't want to do is increase the steroids, when in fact it could be solving the problem at school. And it's just always holding those thoughts, all of the whole person and their whole life together. So when we're thinking about a young person who's got myositis, what we need to do is thinking about strength and recovery. And what's really important is to maximize what you can. So maximizing strength, maximizing stamina, both specific stamina of individual muscles as well as general stamina, and thinking about building energy levels, but pacing that so that you don't end up booming and busting. So it's not about doing too much all in one go, so that then you're exhausted afterwards. And it's about a slow, steady building up of activity, of strength, and of function. But I guess the motto at the bottom, which is doing something is better than doing nothing, is really important. And that's something that, thinking about that day in and day out, I think is really, a really valuable, positive thought. Because even when somebody is very weak right at the very beginning of their disease, and not able to do very much, there's always something that they can do. And the philosophy that we have in our service is that even if it looks like there's very little that you can do for yourself, there will be something, and we should start with that and then build on that. And I think the same goes with, at home, when you're generally much better, and thinking about, how to make sure exercise is, fitted into your life and into your activities. Doing something is definitely better than doing nothing. And I think, that's certainly probably something we've been learning over this, weird world that we're living in with COVID, is that actually doing some type of exercise is better than doing nothing. And that's better for our bodies as a sort of whole. So as a physiotherapist, though, I think about exercise in sort of two very specific and different ways. And I think this is where sometimes things get a little bit confused, because I hear many times that people will tell me that they've stopped their physio because they're doing sport, or they've gone for a long walk, or they've, been busy around the house or around school. And I always come back to the fact that I'm understanding physiotherapy to be like a medicine, so that you can do these other things like sport and walking and playing with your friends. And I don't necessarily think that they're interchangeable. And the reason that I have that philosophy is that for physiotherapy, we tend to stick to what I call simple exercises, which are about correcting the biomechanics. So it's looking at the muscles that are most affected and providing an exercise that builds up that specific muscle, because I'm wanting to correct the biomechanics of the body so that we get normal movement patterns, we get good specific strength and function, we get good and normal forces throughout the joints so that you're not causing pain and potentially damage. And so that's why the physiotherapy, from my perspective, is about specific and focused exercises, so that then you can do more complex exercise, which for my purposes would be around sport, so things like walking and running and all sorts of different sports. So the physiotherapy is like medicine to enable you to live your life however that looks like for you as an individual, safely and effectively. Now, obviously, in acute disease where you haven't got very much strength and you're very limited, then actually what you're working towards may be functional, like sitting to standing, like walking, even getting up off the floor, climbing the stairs. So that would be your complex exercise, your complex activity. And we use very specific exercises to be able to work on those functional activities. As the disease is better controlled, then we'll be using physiotherapy and the specific exercises in order to be able to play football or rugby or American football or baseball. I'm trying to think of American sports. So if we come back to the physiotherapy principles of how to train specific muscles, as I've mentioned, we would take each muscle group individually and design an exercise for the muscles that need to be strengthened. And evidence shows that for these types of exercises to be effective, for it to be a progressive resisted exercise program that I've mentioned will be anti-inflammatory, we need to build up to doing high repetitions. So you start with low repetitions, and then you gradually, day by day, build up the repetitions. And the ideal number of repetitions is 30 repetitions to maximize fitness of the muscle and also the strength. And once you get to 30 repetitions, we build the weights further. We build the strength further by adding in resistance. I use weights strapped to the arms or the legs just because you can be very precise about the amount of resistance. Some people would change starting positions to use gravity in a different way. Some people would use things like therabands. So there are different ways of adding in resistance, but I just find weights a very easy thing to add in at home without making the technique of the exercises difficult. What we also know is that regular exercise, so this progressive resisted exercise program, needs to be done regularly. And evidence shows that at least 4 times a week is best. In some scenarios, I would be recommending the exercise program is done every single day, but building towards making the exercise program done 4 times a week. And then, as I've mentioned, progression is very, very important. So starting at whatever level the young person can do safely, as in, if they're not even able to stand, then we start with a lying down exercise or a sitting down exercise. But we start at the level they're able to do. And then it's a constant, slow and gradual progression to make the exercises slightly more difficult. And every time you make it more difficult, you're asking the satellite cells to come in and help with repair and regeneration. You're also helping the IL-6 and the TNF-alpha to remain balanced. And progression is done, and it's much better if the progression is daily or even weekly, and monthly really reduces the effectiveness. So we need to sort of put things into sort of combination. But I guess what's most important is what you're actually going to do at home as a home management program. And I because we run a rehabilitation program, young people with myositis will be admitted when they're very weak or they're really struggling, and therefore there will be a lot of physiotherapy provided. We provide 2.5 hours of physio a day for those young people in the hospital. But when they go home, we realize that we need to fit into the biopsychosocial model, knowing that this young person's got to fit into a family, they've got to go to school, they've got friends, they need to play, they need to do their homework. And so their physiotherapy program needs to become a much smaller focus of their life. So it needs to be something that's easy to do at home. It can still be progressed at home. I think the physiotherapy is much better to being specific so that it enables the young person to do everything else that they want to do in their lives. Functional, we often put in functional exercises as well, but it's not only functional, it's also specific exercises. But the program needs to be not too long because families are busy and we need to aim for around once a day. And so if we get these things right, then it makes it much easier for the young person and the family to fit this into their lives. So thinking about specific exercises, and specifically thinking about myositis, is obviously muscle weakness is much more profound proximally versus distally. And so we need to really consider that with our exercise programs as well. And so really thinking about strengthening abdominals and back extensors to provide that core central stability that's so important in order to be able to function safely and to reduce the pressure on the spine is something that we really need to think about within our exercise program as well. But we still focus on high repetitions and we still think about progressing that. And we think about each and every step depending on what the young person's able to do at the beginning and how we build that up. And you can change that in all sorts of different ways, changing positions, adding in resistance. So there's lots of different ways of modifying the exercise program to suit a young person. And as I think I've mentioned a lot of times, exercises need to be progressed. There's no point in starting an exercise program and not setting those progressions for the families to work on when they go home over the next few weeks. If the young person's with us in the hospital, we do all the progressions every day. But when I send a young person home with an exercise program, I send them very clearly with progressions as well. And then we're looking towards a young person who has really responded well to their medication, who's responded well to their therapy, their physiotherapy, and they've regained that strength and that stamina of their muscles, okay? And what we're then wanting them to do is to fit that back into their life. But then I think this is almost harder than when you're poorly, is when you're well, is to keep yourself well. I think as humans that once we start to feel better and we start to be busier in life and doing sport and school and those types of things, it's really easy to drop off or even to sort of remember that you have a physiotherapy program as well. But I just wanted to add a caveat that we just need to be a little bit careful, especially in my experience of myositis, is that what I see is that if young people stop their exercise program, even if they're doing other physical activity, then what happens is that they still start to lose their strength from a biomechanical perspective, not because their disease is necessarily increased, but because that they're not doing part of their treatment, which is their specific exercise program. But what you also find that if you keep up with the physiotherapy well after, so up to around sort of 4 or 5 months after their disease is into remission, then actually that muscle develops a good memory of being strong. And it's much easier to then reinstigate, if you stop the exercises, reinstigate the exercise program, and it tends to respond very quickly. So building strength, stamina, but then a muscle memory, which takes time, is really important. And then I guess the reason we're doing all of this is not only to keep the body safe, but it's actually so that the young person can function and get back on with life, and ideally, you know, to the level that they want to be able to do it compared to their peers. Now, it may not be possible to get right back to that level, but certainly there's, you know, an enormous amount of repair and generation that is possible for all young people, especially when you get the disease control correct with medication, and then really adding in that physiotherapy right from the very beginning. And so aerobic fitness then needs to be retrained, and that's what's going to be important for your energy levels, as well as your ability to manage throughout the whole day so that you don't flag by the end of the day. And aerobic exercises are much more functional, so you can build that into sitting to standing, you know, practicing the stairs, bringing in partial weight bearing activities and sport like cycling and swimming, horse riding, rowing, etc. And then progressing on to full weight bearing activities, so walking and running, basketball, etc. And I guess my philosophy is that physiotherapy is very specific and is targeted in a sort of very medical term, so that the young person can do all the things that they want to have fun with. So sport, I think, should be fun. In young people, ideally, it needs to be varied. And we don't tend to limit young people from specific sports as a per se. We just need to make sure that actually they're strong enough and fit enough for the sport that they want to do. So if their sport is table tennis, then clearly that impact on their joints and their muscles of table tennis would be very different to rugby, which I guess would be equivalent to American football, which is obviously a very high impact contact active sport as well. But if they want to be doing that, then we need to make sure that they're strong enough and fit enough to be able to do that. And I guess what you also have to remember, you know, even in healthy, fit children, is that if they've been playing sport intensively, then pain afterwards is common. It's called delayed onset muscle pain. It's something that we all experience as a normal part of human ability to grow and strengthen up your muscles. What it means is you need to do more exercise to correct that probable muscle imbalance or muscle weakness, so that when you do the sport and the physical activity, your body is fit enough and strong enough for purpose. So towards the end of what I want to be talking about is helping you recognize that there are so and exercise will obviously improve quality of life for everybody, but also reduce the risks of other illness, particularly cardiovascularly as well. Regular exercise reduces pain. It also reduces fatigue and improves mood and sense of well-being. And I think it's really important to recognize that children with inflammatory rheumatic diseases are definitely at higher risk of low mood, lower achievement, lower self-esteem, and missing out on life. And I think exercise is a really powerful way that you can use with your young person in order to help address these things. So the exercise, you know, is very safe, it's very effective. And I guess my take-home message is that exercise is a medicine, and it needs to be performed with a certain frequency and intensity. Okay, so you start at the level that the young person's able to do, but you constantly progress that. And what we're aiming for is that as you reduce the medication, as the disease is controlled, you can increase the exercise, not just physio, but sport and other physical activities. And I think it's also really helpful knowing and feeling confident with the fact that exercise in the right dose is the only effective treatment without side effects, without negative side effects. It only has positive side effects. And so it's a very powerful, important tool that you'll have in order to be able to help your young person. But just with a little caveat that exercise, the physiotherapy should be designed individually and adapted to disease activity and ability, with regular follow-ups to progress and to change as the young person changes and hopefully improves with time. And active progressive exercises are recommended to patients with all stages of disease. And as I mentioned, it's better to be doing something versus nothing. And exercise is really safe and really effective. And then you can incorporate the exercise into your daily life, a bit like taking the tablets every day. It's really important, but also doing exercise every day is going to be very important as well. And just remembering this whole biopsychosocial model of care and how exercise fits into that as well. So thank you very much for listening, and I'm really happy to take questions.